Hi, my name is Annie Robertson, and my practice lightning strike today is going to be on medial tibial stress syndrome. First, starting off with the introduction. What is medial tibial stress syndrome, otherwise known as MTSS? MTSS is more commonly known as shin splints, and this is an overuse and repetition stress injury that usually occurs on the medial side of the lower tibia. It is most common in athletes who are running and jumping, such as cross-country runners, dancers, and collegiate athletes. MTSS is also more commonly occurring in females than males and accounts for 1/3 of running injuries, according to a well-known runner's journal. It's most likely the patient will present with symptoms in both lower legs. The treatment for MTSS can vary depending on the severeness of the injury. As with most injuries, ice is always recommended as well as rest. Since this is an overuse injury, any collegiate athlete that deals with MTSS during the season is going to choose to play through it. Some of the most two common treatment techniques include kinesiotape as well as compression sleeves. My PICO question for my lightning strike is, in collegiate soccer players, is kinesiotape or compression sleeve more effective with pain relief for medial tibial stress syndrome? This season, I had the privilege of working with Hampton-Sydney's men's soccer team with both Allison and Hannah, with the occasional guest appearance of Sean. Throughout the season, we dealt with a few athletes who had less severe cases of MTSS. I was interested in the pain management side of MTSS since many athletes chose to play through the pain since the only treatment is rest, and they don't want to be taken out for the season. I focused on treatments of compression sleeves as well as kinesiotape since they seem to be the most successful with pain management. As with any injury and using kinesiotape, there are many different ways of application. Shown on the screen are some different ways that are applied based on where the student athlete or patient is experiencing the most pain. Kinesiotape is applied in two directions with the goal of helping release tension in the affected area. Compression sleeves, on the other hand, need no application and are based on different levels of compression. Some sleeves may have Velcro strips around them to pinpoint certain areas or even lines or arrows that are shown. In theory, these will help swelling and circulation. The most common compression sleeve is shown on the screen for MTSS and is just a sleeve that covers the majority of the lower leg from the tibial tuberosity to the superior aspect of the medial and lateral malleoli. Compression sleeves and kinesiotape have pros and cons which will vary from patient to patient. The largest complaint of compression sleeves are that they're annoying and either slip down or may be too tight. In many cases, both of these scenarios can be solved with a new size compression sleeve. The largest complaint with kinesiotape, on the other hand, is that it may not stick well. This tends to happen often with collegiate athletes who train every day and are sweating as well as showering multiple times a day. With all the information we have on MTSS and treating MTSS, it's shocking how common it still occurs and how serious it can become if no treatment is performed. Sports-specific MTSS from collegiate soccer players is a less prevalent injury. MTSS only accounts for 4% of collegiate soccer player injuries. Since it is so rare, many athletes brush it off to feeling sore, which delays the recovery time and extends the injury timeline. In conclusion, the best pain relief for medial tibial stress syndrome depends on what the patient feels most comfortable with. It is proven that both compression sleeves as well as kinesiotape are helpful with preventing pain. However, neither one is more helpful than the other. It is also found that not many precautionary measures are able to be taken to prevent medial tibial stress syndrome. However, having the correct foot and arch support will help with the correct foot and lower leg mechanics. The picture of the team on the lower left-hand corner is the team that I had the pleasure of working with this past season. I would like to thank them for being my inspiration on this project.